Hello, my name is Patricia Niles, and my population intervention plan is Obesity Management Program Promoting Health in the Laredo Community. The purpose of this obesity management program is to promote healthier lifestyles and increase the consumption of fruits and vegetables, which will have an ultimate reduction in the prevalence of obesity in the Laredo community. By targeting individuals, organizations, and the local community, a strong social support system can be developed to promote healthy living, which will lead to long-term sustainability. Obesity is essentially carrying excess amount of fat around the body. The CDC defines obesity as having a BMI of 30 or greater. Overweight is a term given to individuals that have a BMI equal to or greater than 25. But aside from looking at the BMI, we also need to look at how much weight is centered around our midline. Carrying too much weight around the waistline can put us at increased risk of heart disease and type 2 diabetes. So for women, a waistline greater than 35, and for men, a waistline greater than 40 inches puts us at risk. Obesity is a problem of epidemic proportions. Look around. Everywhere you go, you see people that are overweight or obese. It has essentially become the norm. Thousands of self-help books, websites, personal trainers exist to show Americans how to lose weight, but yet we continue to struggle with obesity. Providers educate their patients on living healthy lifestyles and give them strategies to lose weight, but yet Americans continue on this path. Maybe our approach should move from individual support to community support. Fostering community support can help us provide patients with the necessary tools needed to succeed. As you can see on this chart, Texas is the 10th most obese state in the US, which is about 32% of Texans. And statistics show that if we continue on this path, by the year 2030, we will have over 800,000 cases of obesity-related cancers, over 3 million cases of type 2 diabetes, over 5 million cases of heart disease, and over 3 million cases of arthritis, which is all related to obesity. The prevalence of obesity right now is about 30 to 35%, as you can see on this map. And if we continue going in the trajectory we are going in, more than 13 states will be at 60%. And in 39 states, we will be more than 44% obese by the year 2030. The local community in Laredo is my target population for this project. In fact, it's the low-income Hispanic in Laredo. Local groups such as the Laredo Area Health Education Council, the Laredo Health Coalition, can both serve as pathways to advertise about this weight loss program. AHEC helps provide the community with education programs that foster healthy families or healthy lifestyles. Together, these two programs can disseminate the information to local leaders and healthcare agencies within the Laredo community. Local providers can also serve as avenues to educate the community about the weight loss program. Uh, they can, by observing their patient population, they can recommend and refer patients to this program too. Social determinants related to this problem. Um, the Healthy People 2020 has identified social determinants of health as social and community context, health and healthcare, economic stability, and education. Therefore, creating social and physical environments that support health for all. Within the Laredo community, availability of resources to meet basic needs such as housing, job opportunities, access to health care, access to affordable fitness centers or fitness facilities is very important. Evaluating the community's access to health care, community recreation centers, and affordable healthy food items is imperative for this program to. The model chosen for this program is the socio-ecological model. It was chosen because it's effective at improving healthy behaviors to include healthy eating and physical activity. It can implement change at the population level, and it takes into account the culture of the Laredo community, which can help the success of this program. Social and cultural norms and values can affect the decisions individuals make about healthy behaviors. The Hispanic community is very strong in its traditions. Social and family gatherings are important, and they're very common practice on the weekends here. Families get together and cook ethnic foods, either to socialize with friends or family. Lifestyles really revolve around food, and which is particularly unhealthy in my opinion, like menudo, which is cow belly, barbacoa, which is a cow product that is very greasy, and tamales during Christmas. It's a Christmas tradition for us to eat tamales. As you can see, the socio-ecological model has been adopted for the Laredo community. In the center, you have the Laredoans' knowledge and skills, surrounded by family and friends, local agencies, community relationships, and then public policy. Sectors within the socio-ecological model include systems and organizations. Healthcare systems can play a major role in cultivating healthy eating behaviors by providing weight management classes. The Laredo Health Coalition and the Area Health Education Council can be used to effectively promote obesity management programs or this program. Local providers, to include Gateway Community Health Center and the Laredo Health Department, can support this plan by informing patients and motivating them to be involved in healthy lifestyles. Promoting those restaurants around the Laredo community to offer healthy food options, to include vegetarian meals, can not only help the local community but also improve the overall health. Local farmers markets can be one way for residents to obtain healthy, locally grown fruits and vegetables at reasonable prices. Within the Laredo community, there are a few restaurants that offer vegetarian choices, so implementing strategies to educate the local community of the public's desire to eat healthy can motivate them to offer vegetarian or wholesome menu items. The food choices available in the public sector affect how the community eats, so promoting the support of community businesses is important. Primary prevention focuses on preventing disease before it occurs. Considering the weight management program is tailored to obese individuals, the interventions will be aimed at preventing the risk of disease associated with obesity, such as diabetes, hypertension, hypercholesterolemia. Primary prevention will be in the form of educating the community about healthy behaviors and the benefits of following a primarily plant based diet. Recruitment for this intervention will be obtained through the Area Health Education, the Laredo Health Coalition, along with the local community and public health clinics. Wide dissemination of this program can be achieved through local media channels, which serve as an avenue to educate the community about upcoming programs and events, or to utilize the promotoras, which are community health workers that work within the local community to help them spread the word and recruit patients. When we look at evidence-based practice, the focus of the obesity management program can be looked at by providing community knowledge, uh, the knowledge that they need, and educate them about vegetarian way of life. So using the research that we look at to educate them about what has been looked at in the research, because there's a lot of evidence out there that says that vegetarian diets are healthy and can help them lose weight. And of course, incorporating their cultural beliefs into healthy vegetarian dishes can be a way for them to adhere to a healthier lifestyle. In a review of the literature, the prevalence of type 2 diabetes was 1.6 to 2 times lower in vegetarians when compared to the general population. Clinical trials also indicated that vegetarians also have a greater weight loss than those in a conventional hypocaloric diet. Studies also showed that there is greater reduction in abdominal fat amongst vegetarians, thus achieving improved insulin resistance when compared to those in a conventional hypocaloric diabetic diet. Even for those patients that choose not to be at 100% vegetarian, studies show that those who followed a prudent plant-based diet, which allowed small portions of meat, fish, dairy, showed significant improvements in their overall health. When we look at secondary prevention will be utilized to reduce the impact of obesity by halting the progression to more serious conditions. First, screening those individuals who want to be involved in the obesity management program will be done by evaluating their risk factors to include cholesterol, blood sugar, BMI, and waist circumference. For those that have diabetes, hypertension, and hypercholesterolemia, recommendations will be made for routine medical follow-up with their medical provider. Proposed intervention will be that this obesity management program will include a citywide dissemination of advertisement and information by the Area Health Education or the Laredo Health Coalition, Gateway Community Health Center, and the Laredo Health Department. The education will be in the form of community outreach programs, which will offer a series of education seminars regarding a plant-based lifestyle for weight management, being physically active, and striving for a healthy weight-based, healthy program based on the MOVE program offered to veterans. This program will be utilized as a template and tailored for the low-income Hispanic. This program encourages healthy eating, increased physical activity, and promotes weight loss to reduce health risk and prevent chronic disease. It includes 12 modules that cover nutrition, physical activity, and behavior changes. The MOVE program has 9 healthy living messages, some of which will be adopted for this program, such as eating wisely, being physically active, striving for a healthy weight, being involved in your health care, and managing stress will be some of the modules that will be adopted. The Eating Wisely session will include education on plant-based diets and their health benefits. The program will be offered through the Area Health Education Council that has a UTSA campus auditorium that can be used for measurable objectives. Will be in the amount of fruits and vegetables that are eaten by individuals, and will be measured by the NCI All-Day Screener Survey, which measures the amount of fruits and vegetables consumed. The progress review worksheet, which will be given to participants so they can perform a self-evaluation and voice their changes that they have made since the start of the program. And this kind of helps them keep them accountable for what they say that they're going to do. Barriers to physical activity will be discussed and evaluated at the initial session, and benefits of exercise and a thorough review of how many calories are burned through exercise will be reviewed also. Many times people don't know how to start exercising, so I wanted to incorporate a discussion on how to start exercising and how to utilize the Borg scale, which determines the intensity and effort that one is performing an activity. Participants who have not been involved in physical activity will be advised to start light and work their way up to either hard or somewhat hard on the scale until they can get conditioned to work a little bit harder. We'll also talk about managing stress, teaching participants about mindful eating. Managing stress includes looking at barriers to healthy eating, teaching participants about mindful eating and looking at the reasons why they're eating. Sometimes this can teach the participants to be more cognizant of their temptations that they face every day. The biggest obstacle is the emotions that drive individuals to eat. And sometimes if they can learn how to manage that or how to control that, they'll be better able to make healthy choices. The NCI All-Day Screener Survey, which measures the amount of fruits and vegetables consumed. This is going to be used as a measurable outcome. The progress review sheet can also be utilized to look at their progress and keep them accountable. The BMI, waist circumference, and their weight will be measured. Evaluation and assessment of improved glucose levels, and the program, once the program ends, at 3 months, 6 months, and 1 year after the program. So these are all going to be measurable outcomes that we'll be able to look at the beginning, and then towards the end of the program and 1 year of the program. Surveillance can be loaded to laptops and completed by patients at the initial session and at the end of the program. Surveys can be collected through SurveyMonkey, and then SPSS can be utilized to calculate the statistical significance of the variables. So there'll be some data collection that will have to be done, and this is going to be done by the local promotoras that are helping us. The Community Preventive Service Task Force recommends um, diet and physical activity that can help prevent type 2 diabetes and reduce the overall incidence of new diabetes. 53 studies were found through the community guide that combine diet and physical activity, which can help prevent type 2 diabetes. In 2010, Congress authorized the development of a diabetes prevention program to help communities implement strategies to reduce the onset of diabetes. And although the diabetes prevention plan programs address the reduction of diabetes, it is important to note that increased weight and BMI is likely the main cause of diabetes. So the objective of the obesity management program is to provide comprehensive tools to reduce weight through eating more fruits and vegetables, as in a vegetarian diet, and increase physical activity, thus lowering the risk factors associated with obesity and high blood pressure and cholesterol and diabetes. The program will cover a wide range of risk factors and have a greater overall health benefit for its participants. In conclusion, I think that the Laredo community needs to confront the problem of obesity by supporting a community-based program such as the one proposed. Incorporating social, community, and organizational support may prove to be effective in combining the problem of obesity within our community. Adopting strategies from other successful weight loss programs that can help us succeed and reduce the incidence of obesity in Laredo. The success of this program will include the support of the community and health organizations in the local area. Primarily, succeeding is dependent upon the support of the individuals who wish to make the serious changes in their life in order to avoid chronic disease and become healthier. The results of this program will provide evidence that incorporating a plant-based diet, physical activity, and dealing with social stresses can help individuals make the lifestyle changes they need for a lifetime. These are my references, and this concludes my presentation. Thank you very much for your attention.